we're working out of one room.
It's difficult when you have people calling you that really need to come in, say today, but when you're fully booked, you want to fit everyone in, but you can't.
So it does limits what you're able to offer.
You're listening to the One Door podcast. One Door, a first of its kind collaborative hub. One Door that will ensure women and families can access coordinated wraparound support in a safe, dignified, and supportive place.
Women are, we hold things together. So yeah, I think sometimes put ourselves at the bottom of the list because we're taking care of everyone else around us.
What do you wish more people understood about women's healthcare in rural Nova Scotia?
We're here for them.
So we're here today at the Lindsay's Health Clinic at the Antigonish Women's Resource Center. I'm joined by Pam Reyes, nurse practitioner, and Denise Hart, the clinic coordinator. Denise, tell us about the clinic. You're the one taking calls from patients who are looking for services. What kind of needs are they looking for?
We have a lot of need, especially with providers retiring, especially in this area. There's a lot of people calling here recently because they don't know where to go. We have a lot of seniors that call that are, not into technology. So they find the Maples app really confusing and they're on the 811 list. But, they have medications to renew, just blood work, stuff like that. But
okay.
Yeah.
So you encounter a lot of first-time patients really not knowing where to go or who to turn to in the current healthcare system.
Yes.
Mm-hmm.
Yeah. We have a lot of people that come that are not comfortable with a male provider for anything female related or, a lot of menopause questions lately. We have, a lot of people feeling just unheard when it comes to that kind of stuff.
Mm-hmm.
So they reach out.
Okay. So can you take me through some of the main services the clinic offers to patients?
Basically, we do a little bit of anything and everything. So like Denise said, we see people from all different ages, from all different areas with a vast array of needs. So we might be seeing people for something like, my primary provider left and now I need a refill on my thyroid medication. But we're also seeing people who are asking a lot of the female-oriented type of stuff. So we can do a little bit of everything. So we can provide medications, we can provide referrals to other providers, specialists. We can provide, referrals for testing like imaging, x-rays, things of that nature. We also can provide referrals to other services such as, therapists here at the center. We're able to work so collaboratively with people like our therapist, our trauma therapist, with mental health and addictions, with a wide array of services. So really, basically, we can do whatever it is that the person needs. That's what we're able to do.
Mm-hmm. It sounds like this clinic helps fill some of the gaps that people are seeing in the healthcare system. Like you mentioned, technology barriers, family doctor barriers are huge right now. Do you feel that the services you offer here actually divert some people away from some of that clogging of emergency departments that we're seeing currently?
Oh my gosh, yeah. Definitely.
Yeah.
Mm-hmm.
Well, I mean, people are able to come here. We've heard stories of people going and sitting in Emerge because they need a refill on their blood pressure medication and they're waiting for hours and hours because they're assessed and triaged at a certain level. And so, more urgent cases are coming in and getting in before them. And so they're just sitting there waiting.
Mm-hmm.
So we're able to see those cases to take that burden off of healthcare. Also, people being able to come in and have those conversations, hopefully, the hope is that people come in earlier when it's, a smaller problem, and then we're able to address it, more upfront, that concept of, upstream thinking. Let's work with people before they fall into the river, before, our healthcare system that's pulling them out of the river downstream. So that's kind of our hope and our goal of what we're doing here.
Right. And your practice has a particular focus on prevention. So wanting to get in earlier with patients. How does it impact patient care when you meet with someone and they've been navigating their day-to-day on their own, maybe adrift in the healthcare system, not getting their needs met? What kind of impacts are you seeing there?
Oh my gosh, that is like a really big, loaded question. I feel like
We can unpack it. We can take it apart.
um,
Because
You know-
there must be an element of catch up with some patients if they've been suffering or managing on their own for quite some time.
yeah. And I think, like Denise mentioned, people come in sometimes and they feel unheard. So now, yes, there might be, maybe there's been years of issues
And
that,
frustration.
yeah. And so I don't even really know how to answer that, quite honestly. I think it is just every case, it has to be handled so individually.
Yeah.
And it really comes down to what are the needs of that person in that moment. And it's just taking it kind of one thing at a time.
Okay. Are there any examples we could talk about where someone's feeling unheard by their doctor or the healthcare system? Maybe they're going to emerge with symptoms and they're being told, they're not getting a clear path of treatment. So what does that look like?
I don't know if I could speak to a specific individual case, but I could say in general, I think women in general often feel misunderstood or misheard. And some of that stems from, science in general. We have not done a good job of researching women's health issues and what are the different treatments or options that we can provide to people. And so I think there's a lot of, I don't know what the right word is, but like unsurety around, as a provider, how do I approach that? Because where's the evidence? Where's the science to back up what I'm doing? So I think that's a big piece of it.
And yeah, I'm interested in that. And, studies not being done on women's bodies specifically. Is that something that's more impactful in Nova Scotia healthcare, or is that widespread?
I'd say that's widespread.
Yeah.
Yeah. Yeah. North America in general.
And then what, on a smaller scale here at this clinic, how are you maybe managing that?
I think it helps as a female. I think it's helpful for people to then relate, to share experiences. And I'm certainly not saying that I've had or experienced every experience. But as a female, I think it puts me in a position to be a little bit more empathetic and a little bit more open to hearing what people have to say. And also having the curiosity to say, okay, let's figure this out together.
Okay. So, we're actually in the clinic space. It's very warm, very inviting. It's giving this feeling of safety. And you're both about to embark on your day full of clients after this. What does a typical day look like for you?
Denise running the show.
Okay.
Telling me what to do.
Chaos coordinator.
Yeah. Okay. Yeah, chaos coordinator. We'll have a steady stream for the morning, typically in the afternoons. Yeah.
Is it difficult to manage the demand?
I mean,
clients?
it's difficult when you have people calling you that like really need to come in, say today, but like when you're fully booked, you want to fit everyone in, but you can't. Like it's hard, especially when you're running like a month ahead. You just sometimes hope for a cancellation for someone to get them in. I do have a cancellation list, so we do work off that a lot, but it's hard when you hear someone on the other line being like, they're desperate to come in. So I don't want to overload Pam, but some days I want to book all the people. But yeah.
Yeah. And what about you, Pam? What does your typical day look like?
Denise blocking her.
Denise packing the schedule full. Busy. It's busy.
Yeah.
It's very busy.
I want to talk a bit about some of the chronic conditions that women in particular can face in many stages of life. What are you seeing among different age ranges coming in with chronic conditions that patients are managing on their own or without any other care or support?
I get a lot of calls for people, like, again, I think I mentioned, but menopause seems to be a huge one lately. People just desperate to find solutions to help them. Endometriosis is also another one that you get calls about.
Right.
Yeah.
Menopause seems like it's recently
Just really,
almost like a taboo's been lifted on the
Yeah.
conversation.
Mhm.
And is that revealing much more need among patients, whereas people just didn't have the idea necessarily to seek care in maybe 10, 20 years ago?
Yeah, I think it's that because we didn't talk about it before,
Mhm.
people just dealt with it
Mhm.
and they experienced these awful symptoms and carried on with life because that was kind of what society expected
Mhm.
of us. And I think now people have the ability to say like,
yeah.
hey, this is going on and this is not okay. And
Mhm.
I shouldn't have to go through this. And
Is
I
this
shouldn't have to
normal?
experience. Yeah.
Mhm.
Like this shouldn't be our normal.
Mhm.
So I think, and a lot of social media has done a brilliant job of helping in that regard, to really share information.
Mhm.
Some accurate,
So,
some not.
right.
Some
Some we're still figuring out.
some we're still figuring. Yeah,
Mhm.
absolutely. So
Mhm. So with that maybe influx of demand, how would you describe the readiness of our healthcare system to meet that demand, like on a provincial level?
it's a work in progress.
Mhm.
It's a work in progress. I think we acknowledge that there are gaps and areas that we need to work on and information out there that we can learn so that we can, once you know better, you do better.
Mhm.
So I think in general, it's a work in progress.
Mhm. Yeah. And my understanding is this clinic operates independently of the Nova Scotia healthcare system. What perspective does that give you, maybe compared with some of your peers who work in a hospital setting?
So so it's a little bit, we're like in a gray area.
Okay.
So I'm actually employed by Nova Scotia Health.
Okay.
And so I'm contracted to be here to work out of this clinic, which is amazing.
Mhm.
I love being in community. I love working outside of a hospital setting for a number of reasons.
Mhm.
And so it does make it, I feel like it makes it easier in that we're more accessible to people.
Mhm.
Um,
That does present to me as the differentiating factor.
Yeah.
I mean, even a month, like that would be difficult for someone in crisis to wait,
yeah.
but that doesn't seem like a long time when you compare it with some family doctor waits and
Yeah, because
wait
some people
lists.
call family doctor provider appointments are 2 months out. They'll be like, I can't get in to see my
Mhm.
provider for 2 months.
Mhm.
So
Mhm.
yeah.
Okay. Yeah, I'm curious about that independence or kind of the gray area. Any more to say on that? Do you feel less constrained in what you're able to offer patients than maybe in those other channels?
Yes and no. And that's kind of where I think that there's opportunity. I think there's a lot of opportunity.
Mm-hmm.
So this clinic, so I'm here 2 days a week. That's what I'm contracted to be here. I'm in another clinic other days of the week.
Mm-hmm.
And I think that right there is the crux of it. There's so much opportunity and there's so much need
Mhm.
in that this clinic could be, I could be here every day.
Mm-hmm.
And there's opportunity in terms of, yes, we can do a lot of things. And there's also other things that we could be doing. We could be doing a little bit more if we had the resources, the ability,
Mm-hmm.
I don't want to say the funds, but really it comes down to dollars and cents.
Right. Mm-hmm.
But yeah, if in a perfect world,
Right. Well,
there's-
let's talk about that because, expansion is the topic and funding is a big part of that. So with additional funding and the ability to expand the center and the space, building on the cohesive referral nature that is already in place here, what would it look like in a perfect world if you could expand the offerings of the clinic, say over the next 2 years?
You could probably, what the wait times clearly,
Mhm.
and especially if we could get the word out that we're here more than 2 days a week, or
Yeah.
the demand is certainly there.
Yeah.
Because people call, like
Mhm.
it's
right. Expanding the accessibility to appointments, not just during the day. You think about it like, I think about my situation. I have the privilege that if I needed to take him to a provider somewhere, I have the privilege to be able to do that quite easily.
Mhm.
Whereas my partner,
yeah.
the particular job that he works in, if he doesn't go to work, he doesn't get paid. So I think about people in that position where if we're only here during the daytime for a limited number of hours, how are people accessing the service? And then how does that impact them, personally, financially, if they're in precarious housing? Like, there's so much more to someone than just, hey, I have high blood pressure. And I think, like, that's where we could do so much more. We could offer more hours. We could offer more services. We could have more providers.
After hours would be amazing as well, because that is really missed in Antigonish.
Right. And that's something you had here previously was the after hours clinic prior to COVID?
Yes.
In Antigonish, yeah.
Right.
Yeah.
Okay. And possibly that could be on the table with the expansion of the new build, bringing that back and letting that barrier go for those patients who otherwise might not be able to access the center.
Yeah, like you said, can't take time off work.
Right.
So,
Right, because then they can't pay their bills. And
Right. What other challenges do you see with your patients that could be societal or connected to maybe other services the clinic offers, maybe related to those chronic conditions like you mentioned, endometriosis? Like what does the day-to-day look like for the patients you're seeing?
We have a lot of women's health, like a women's checks, like pap smears, like STI testing. Like, we have a lot of people just needing blood work. Haven't had a doctor or provider in 4 years. Or 5 years. I had a call the other day. I had a woman call last week. It's been 14 years since her last pap. So like in time, but time goes by really fast. So like she's like, I'm embarrassed to say, but we have a lot of women's health.
Yeah. Okay. So it sounds like, sorry, I just lost my train of thought. There was something I wanted to get at there, but it's not just the barrier of access. It could be lifestyle, like time flew by working. It sounds like the clinic does a really good job of meeting people in the community to raise awareness about your existence and getting those new calls from prospective patients.
Yeah.
we try.
Is there a strategy behind that to try to meet new patients and raise their awareness about what the clinic can offer?
We have been doing a lot more on social media, and we find that does get word out. I feel also lately it's word of mouth. We have a patient that comes in that had a great experience. Last week we had on a mom's group on Facebook, someone was promoting it. So, I mean, that little things like that. Certainly.
Right. That's a big touch point for women, I think, is the moms group. That's when a lot of women have to get serious about finding providers for sure. And at the clinic, you offer a trauma-informed, patient-centered approach. How does that show up in the care that you provide to patients?
I think we had a provider say it's when a trauma, like a patient that experienced trauma, to go into a hospital setting can be really triggering for them. So when they come through the door here, they feel that calmness and it's not. Yeah, the hospital setting, it can be a bit of a trigger for a lot of people. For a lot of people, it's the smell. I always found it was the sound, like the kind of the hissing of a respirator or like the beeping. It kind of puts you right into that mode. Yeah. This space is very different from a hospital setting. So how do you find that your patients respond to kind of the safer space that they have here? They love it. Yeah.
I think they generally feel more comfortable. They feel
at ease almost.
Yeah, more at ease and better able to then, talk about the things that they want to talk about because they're in a space that feels comfortable, that feels safe, that feels like, okay, I'm not going to be judged here.
And then a big part of the clinic mandate is referrals within to other services. Yes. Do you think that safety of space makes it easier to get into those conversations with patients and identify other needs that they might have within the clinic?
I think so. Yeah. I think, when people go into a space and they've been there before, that familiarity makes it easier to then walk through the next door.
Mm-hmm.
And especially when the next door, and I
Mm-hmm.
point behind me because this door goes into the women's center area. So being able to say like, hey, here's our trauma therapist. They're right over here. Or here's our women's support workers. And this is what they can do for you.
Mm-hmm.
Being able to have that right here for people, one positive experience generally leads to more experiences, more willingness to engage, and better outcomes overall.
Mm-hmm.
Yeah.
And there's also a health and wellness coordinator in the clinic. Do you work closely with that person? Because I've heard about some programs like I think an endometriosis support group.
Yes.
Is that currently operating, or is that
Yep.
future plan?
She does like
Okay.
cafe type.
Okay.
Yeah,
So what
so-
does it
yeah.
look like for a patient who you're treating for, say, chronic endometriosis, and then they're going to the support group? Does that just kind of flow naturally, or how does that come together?
Well, that's a great question. And that's one that I don't necessarily know. All I can do is I'm able to provide people with the information. And that's where we're very lucky and privileged to be able to have that option for people, or that information for people.
Mm-hmm.
And then what happens after that, I often don't know.
I did have a patient call last week that I told there was going to be a group on, I believe, this Wednesday.
Mm-hmm.
And she was really happy to hear about it. And I did call her back to tell her about like other groups that would be closer to her in Guysborough. So she was really happy to hear that
Mm-hmm.
because she's been suffering with it for so long.
So is that an option for someone who maybe is on the wait list for an appointment? They could come and access that.
Yeah, I did tell her she's waiting on a referral. But yeah, she just to talk to someone that can relate. So you it's, I'm not the only one.
Mm-hmm.
Yeah.
Yeah. And you mentioned Guysborough, which I know the clinic serves Antigonish. We're located in Antigonish, but also serves all of Guysborough County. What does that look like for the Lindsay's Health Clinic?
We have a lot of people from Guysborough County book in, like Sherbrooke area, like Canso. Yeah.
And we also have people coming from further
Yeah.
because
I've had calls from Halifax.
because of lack of providers.
Okay. And how are they connecting to you? Maybe just seeing online, seeing on Reddit recommendations?
Yeah, I think there's the Sugar Health website. We're on that. So people, it's online. Like they go under looking for women's health clinics.
Mm-hmm.
Yeah.
Mm-hmm.
But yeah, Halifax, I've had Sydney,
Mm-hmm.
Shetty Camp. Yeah, all over.
Do you see that? Is that a trend that's rising over time? People traveling further?
Yeah.
Okay. So what do you make of that?
Just people not having access to care. And
The level of desperation that people are feeling. I mean,
there's only so much Maples can do. Like they
Mhm.
want to be seen by a provider. Like they want to be in a space with someone.
Right.
Yeah.
Yeah.
And
you-
lots of things can't be done over virtual care.
Right. So there's limitations there. You've mentioned Maple a couple of times. That has become kind of a popular thing in the past few years. But tell me about some of the limitations maybe you're seeing with patients.
People I find call, they don't want to be going online. They don't. Again, a lot of seniors are without doctors. It's wild, but they're not familiar with that kind of, technology. They just don't know how to do it. So,
And maybe don't have someone advocating for them along the way. Right. And then I guess my next question is, the center serves women and gender diverse people and offers services in the realm of gender-affirming care. Can you tell me a little bit about that?
we are able to provide gender-affirming care. And again, it really comes down to meeting the individual needs. And that really is the ultimate point of all of that. So whatever that person may need, whether it's an assessment, a WPATH letter for referral, for services, then we're able to offer that.
Okay. And how would you say Nova Scotia is doing in terms of its preparedness to offer gender-affirming care and having medical professionals educated in that area?
I think it's another one of those things that it's a work in progress, really, truly. And I say that having gone through WPATH training training that was WPATH approved in 2017.
Mm-hmm.
And so now here we are in 2026, and the amount of people that I see that are embarking on that training, that are participating in gender-affirming care
Mm-hmm.
education and
Mm-hmm.
is growing.
Do you think that patient access is dependent on the willingness of providers to educate themselves and pursue that sort of education to be able to meet those needs?
Sometimes. I think in some situations, and I certainly won't blanket and say all,
Mhm.
I don't think that's fair, but I do think, as a general provider, so as a nurse practitioner and
Mm.
in primary care, I'm expected to know a little bit about a whole lot of things.
Right. Mhm.
And I'm certainly not an expert in any one particular thing. There might be some things that I know a little bit more about, but by no means am I an expert. But I think what's most helpful is knowing that there are places that we can go, that there are people out there who are experts. And we do have that in the province.
Mhm.
The caveat to that is that they're not necessarily located in our backyard.
Mhm.
And that is the struggle. And that is, a big
Mhm.
piece of the barrier puzzle that we find, especially in, a more rural area.
Mhm. Yes. No, that's amazing. And do you find that when you have gender diverse, non-binary patients coming in, are you detecting anything about their experience in the healthcare system and their feeling of safety navigating healthcare?
I think there's definitely apprehension.
Mhm.
I think, anyone, when you go into a new space and you
Mhm.
meet a new person and you have no idea how that's going to go. And especially if you've had maybe some not so helpful experiences in the past, it can make you very hesitant and cautious.
Mhm. And how do you feel that their reaction is to this clinic setting?
Like
I
it's-
hope okay.
Mhm. Mhm.
Yeah.
I think we really truly do strive to make a space that is all of those things:
Mhm.
welcoming, inviting, safe, non-judgmental.
Mhm. And then I just want to touch a little bit on, we've become more familiar with the concept of healthcare worker burnout. I imagine this job is difficult to do at times. How much does working in this collaborative setting help with that?
I would say tremendously,
Mhm.
truly. This space in particular, I feel very fortunate to have such a supportive group of people around me,
Mhm.
that it makes the hard things and the hard days a little easier.
Mhm. It seems like a very collaborative setting. And then
Yeah.
embarking on the one door goal, is that kind of driving and bolstering people's kind of spirit as they navigate these jobs?
It's hard to say. Like, I don't know that
Mhm.
I can speak for other people.
Mhm.
But I think
That's fair.
there's definitely an outlook of, wow, think of all the things that we could do. Like, we have
Yeah.
running lists, like
Yeah.
somewhere, like
Mhm.
all over the place.
We
Like
have all kinds of ideas.
Yeah, we have great
Okay.
ideas. Don't ask me about them right now,
Well,
please.
I am going to ask, but like you don't have to. I'll ask Denise first. Like, give me an example. What's something on the wish list?
Pam full time.
Full time. Okay.
Another provider for sure.
Mm-hmm. Yeah.
Feel like the center offers so much, like with Allison, the health and wellness coordinator. She's going to be like the birth doula. So you may have people that don't have family supports and they, just to have her with them. Like there's all, I don't know. We could,
More space, like
More-
having more people, like, but also outside of but outside of nurse practitioners, but being able to have, like a pharmacist
yeah.
who could do medications with
Mhm.
people,
Mhm.
Especially when people come in with their list of medications.
Right.
And so trying to do, a bit more complex med management, how great would it be to have a pharmacist where they're the experts in that, to be able to look at that, safe prescribing.
What does that look like currently? If you get someone with that complex list, you're having to send them elsewhere to get
Yeah.
that all coordinated.
Yeah.
Okay.
Yeah.
So that
basically.
slows you down.
Yeah. I mean, we do what we can within the scope of what this clinic is.
Yeah.
And then beyond that, that's where we have to lean into the other resources that are in our community.
Mm-hmm.
Mhm.
Yeah.
Okay. And Denise, you mentioned you're going to have a birth doula.
Yes.
So do you ever get calls
Or
from...
she is a birth doula now.
Oh,
Yeah.
okay.
Yeah.
Wonderful.
Yeah.
Do you ever get patients who are maybe postpartum and they're, like you said, unsupported? Maybe they're seeking help and you don't exactly have a service currently that meets their needs. Is that something you're seeing?
I had a couple particular patients that had called, but we were able to get them in with Sienna. She's here once a week on Thursdays. So we can get them in touch with her. She does 1 to 3 sessions, gets them kind of on the right path to the right services. But and then we can get also on the waiting list for Terry. She does have a wait list for the trauma therapist or even the support worker. Sometimes people just need that support. So we were able to use our services within our little family.
Right. So
Yeah.
sometimes people are calling and you're not necessarily booking them for the clinic,
Yeah.
but referring them
Or we
elsewhere.
can book them in, but again, if it's a month out, but I suggest something and they may that'd be great. And then that gets them on another path that is helpful. Yeah.
Yeah. What do you wish more people understood about women's healthcare in rural Nova Scotia?
We're here for them. Sometimes travel is a big restriction for people,
Right.
not being able to get here.
Do you hear that from prospective patients that you're willing to book, but the logistics on their end?
Yeah.
They're
So
not
we
able
do
to get
offer
there.
phone calls for some cases. I mean, again, it comes down to people wanting to be in person, but sometimes a phone call. We try to meet their needs, if it's
Some sort of transport program.
Yeah.
That's where my mind goes for that.
We again, and it's a senior population in more rural areas, not all, but in some I had one particular call this morning. She couldn't make it last week because it was raining really hard and doesn't like to drive in the rain. So weather is a big factor too. People are scared to drive. Yeah.
Okay.
And they live 45 minutes away or, they're not just
Yeah.
coming from town.
Yeah. It's a big undertaking. What about you, Pam? Are there trends that you notice that might be specific to rural Nova Scotia?
What trends do I see? I think the biggest, I don't even know if this is really what you're looking for, but I think the biggest thing that I see is that people often delay care, really, because of past experiences, because of accessibility, because of a million different reasons.
Yeah.
And that compounds the treatment process.
Yeah. Yeah. It can make for, more complex cases, more time, more discomfort and frustration for the person.
So going back to the one door concept, if one door is built as planned, what changes for the people you serve?
Quicker access, not having to wait for so long.
Helping with that prevention focus and
Yeah.
getting ahead of issues rather than chasing them.
Chasing them, yeah, for sure.
Hopefully all the things.
All the things.
All the
Yeah.
Okay. Yeah.
Will be amazing.
We already are.
Well, I'm just gonna
You are.
just make it.
So having the one door clinic, the new clinic, will exactly, it opens up that opportunity, not just for space, because you think about it right now, we're working out of one room.
Yeah.
Well, you have a room. We have a
Yes.
waiting room and a clinic room, and that is it. And currently if you had more providers, we're sharing a space.
Yeah.
And so then, how does that impact? I mean, that impacts each person, but then it also impacts people coming in and, because it's a shared space.
Yeah.
So it does limits what you're able to offer in that regard. So having more room, purely more rooms, so we could have more providers. So having social worker, having a pharmacist, having mental health and addictions counselor, nurse practitioner, having a nurse, being able to not just do, episodic care, like an acute care issue, or, I have a sore throat. What can I do
Yeah.
about this? Or coming in for STI testing, not just being able to do that, but also being able to do programming and education offering and, just the full scope of wraparound services of essentially one-stop healthcare shopping. And here's all the things that I need right here in one spot. In one very welcoming, hopefully welcoming, inviting spot.
Yeah.
I think it'll be welcoming. I get that sense.
Yeah.
And will accessibility change with the one-door clinic or increase?
That would be the hope in terms of like hours. Absolutely. I keep going back to that. What if somebody can't come see us because they have to work, because they have to keep groceries on the table and they have to keep a roof over their family's head? We're missing a lot of people because of our limitations. So if we could open that up and we had the ability to do that, or simply by providing care to people's family members.
Yes.
Because if you're supporting my partner, then you're also supporting me. But I go a little rogue sometimes in that.
No, that's okay.
In that vein.
It sounds like you're speaking about a reality that a lot of people are facing in this area, which is, the day-to-day navigation. Do you think that women in particular are more likely to delay care because they might be carrying, this fixed burden of having to work and get people to where they're going and not able to attend to their own needs?
Absolutely. On the heels of Mother's Day, where moms are expected to do everything. Women are, we hold things together for a lot of people in our lives, and then throw in generations and we're talking, sandwich generation. And here we are. And I say that being in it.
Yes.
I think sometimes we put ourselves at the bottom of the list because we're taking care of everyone else around us.
Right. And so clinical offerings aside, how does this clinic message that to the community to kind of encourage them to put themselves first and put their health needs first?
And I think that's probably the biggest and best way is that people are experiencing it and then they're sharing their experiences with their friends, with their family, with, social media communities. And I think that's how it gets out now.
Yeah.
We try and do our part with our social media and,
I do think an after-hours clinic, though, would be amazing for everyone.
Right.
As well.
Pam, Denise, thank you so much for your time today. I know you have a busy day. You have clients scheduled to come very soon. So I really appreciate you welcoming me in and sharing about your experience and this important endeavor that's with One Door.
Yeah, thank you.
Thanks.
Together, we're building a healthier and safer future for generations to come. Your support will help create a safe, supportive, and empowering space where women, elderly, families, and youth can heal, learn, and thrive. To donate, visit onedoor.awrcsasa.ca. Every contribution, no matter the size, directly supports programs, services, and spaces that foster dignity, care, and community strength across rural Nova Scotia.